us survive, so we spend our time to the fullest we can. We're seeing our lives have purpose.
Hi, welcome to Professional Insights, created by Dementia Action Alliance. I'm proud to be your host, Laurie Scherer. During our Professional Insight podcast, we have educational conversations with professionals in the dementia community to provide answers and support to people living with dementia and care partners. My guest today is Dr. Rebecca MacAulay. We will be exploring the difference between a diagnosis of mild cognitive impairment, known as MCI, and various forms of dementia. Dr. Rebecca MacAulay is an associate professor in the psychology department of the University of Maine. She's a director of the Care Lab and a licensed clinical psychologist specializing in cognitive aging. Dr. MacAulay's research program aims to advance brain health and quality of life across the adult lifespan by developing novel assessment and intervention techniques to detect and treat those at risk for cognitive decline. She has a strong track record of multidisciplinary research partnership and scientific publications that are dedicated to better understanding the intersections between physical, cognitive, and mental health disparities in adults. Dr. MacAulay, it's wonderful to have you with us today. Welcome, and thank you for giving us your time.
Laurie, thank you so much for inviting me and for having these conversations. It's so important, and I'm frequently asked these questions, so I'm really happy that we can have these discussions today.
Wow, awesome. Well, let's get to them. Question number one, what is the difference between a diagnosis of MCI versus a diagnosis of dementia?
Yeah, so the mild cognitive impairment can be misleading. Sometimes people think like, oh, it's mild, it's not that bad, but really what it's referring to in MCI is that the cognitive impairments have not impaired someone's ability to daily function. So someone with MCI is still able to drive, they're still able to manage their own finances. There may be some decreases in their efficiency in doing instrumental activities of daily living, but overall, we're not seeing impairment. And so with dementia, that is someone who now is showing those deficits, and that they actually now need someone, they require assistance in being able to do things that they used to be able to do. And so that's when someone converts from MCI to dementia, is when we suspect that both there's a dementing process, such as Alzheimer's disease, and that now they lost parts of their independence.
Okay. How does a doctor decide what label to put on the diagnosis? For example, if I can't keep my own checkbook anymore, but I can still drive, how do they decide where to label me?
Yeah, well, so typically, what we would want is a comprehensive assessment to evaluate these changes. What are the causes of these changes? Is it a medically reversible condition that's causing any type of difficulties? Before making a dementia diagnosis. But when we do start to see, that there are changes that are impacting daily function, that's when we start thinking about, is this a dementia diagnosis? But prior to that, we really want to make sure that we've ruled out any other conditions that could be contributing to it.
Okay, thank you. Dr. MacAulay, many of us have had multiple dementia diagnoses. Diagnosed with Alzheimer's, then Lewy body, then Alzheimer's again, and then latest label MCI. What should we look for to help the doctor get a true diagnosis? When I go into the doctor, what things should I tell him or her so that will help them in the process of providing a diagnosis?
Yeah, so when we start getting into different etiologies, which is really what we're saying with Alzheimer's disease, Lewy body, those are saying like these are some of the causes that could be related to someone's MCI condition. And so to really get a clear picture of that, we need to do more comprehensive testing. We need to get imaging. Usually we're ordering certain types of biomarkers. That would help support that diagnosis. And so without those, it's not really possible to clearly say what type of dementia or MCI someone has.
Thank you. So if I can, you said that with MCI, it kind of ends when someone needs help with daily routines. What would be when would you define that as they need help with their daily living routine? Is there a pinpoint of things is it more important that I can dress myself or more important that I can't cook anymore? Is there any kind of a marker on what's considered not being able to maintain your daily living?
Yeah, so when I do assessments, I do neuropsychological assessments where we, are working as part of an interdisciplinary team that we're looking at cognitive abilities, someone's ability to remember, someone's attention, problem solving, those different things. And then, we'll usually, ask questions related to the ability to reason, right? So, what would you do in the case of a fire? Who would you call to look at safety concerns? We'll look at, can someone still manage their finances independently? And so, when we start to see that, there's changes in those areas, particularly with more than one or two more things affected, then we do start to become more concerned that it looks like dementia.
Okay, thank you. I was vice president of a bank for a number of years, and I can't add or subtract and I can't count money. But
Yeah.
yet I can function very well.
Mhm.
I had a
Yeah.
diagnosis of FTD. And it's difficult sometimes because people look at you and say, wow, you're so high functioning. Well, in some areas, that's absolutely
Yeah.
correct. So it's challenging. And I feel sorry for all of you that are trying to make a diagnosis, not living with us and not really knowing
Yeah.
what we live through. That's why I think we need to know what's important to tell the doctor. And so I thank you for sharing some of those ideas with us.
Yeah.
Um,
And can I follow up? Just,
yeah.
we also have to look at the frequency and the severity, right? Because everyone will drop a word. Everyone will forget where their keys are. We make mistakes sometimes, right? We're human. So you also have to kind of consider what is the normal range and what is that normal range and baseline like for each person. And so I think that's where it's really challenging is without a more comprehensive evaluation, sometimes these things are more nuanced, such as what you're describing.
Awesome, thank you. I often tell people a form of dementia is not saying, where did I leave my keys? To me,
Hmm.
I know my dementia symptoms are acting up when I hold my keys and go, what do I do with these? It's not
Hmm.
walking into a room and saying, what did I come in here for? It's walking into your kitchen where you've lived for 20 years and going, where am I? What do I do in
Yes.
this room? So there's differences in that, but we all throughout life, I think, from the time we're born, we
Hmm.
all do things like lose our keys.
Yes.
Okay, thank you. And I have one more question for you, Dr. MacAulay.
Hmm.
Will MCI always turn into a form of dementia?
No. No. Um, so when we look at, the annual rates of conversion from MCI to dementia, In clinic settings, because we're obviously getting referred a higher proportion of individuals who are at greater risk, there's a conversion rate of about 15% per year. In the general population, research estimates see around 3 to 6%, so much lower. When we look at research that looks at things such as functioning, the severer the deficits in functioning, then becomes the best predictor of conversion. And so we do see there's moderating factors in a large proportion. Not only don't convert, sometimes we see with MCI, particularly if there's other things that are treatable, so we see alcohol use, untreated sleep apnea, vitamin deficiencies. Sometimes we'll see people who will have mild cognitive impairments due to medical conditions come back a year later, and we might even see some benefits where not only are they stable, maybe they don't meet that diagnosis once we've addressed those medical risk factors.
Wow, this has just been a wealth of information. Thank you so, so much for coming onto Dementia Action Alliance to share with us this question. We've had a lot of people asking, what is the difference between MCI and dementias? And we appreciate you giving of your time today to be with us.
Thank you so much.
Dementia Action Alliance is committed to enhancing lives, connecting people, and increasing understanding. I'd like to thank all of you for joining DAA for our Professional Insights podcast. More podcasts and valuable resources are available at daanow.org. You can help continue these podcasts and other programs that enhance the lives of the dementia community with a donation at daanow.org. Thank you for joining us and have a wonderful day.
We're working to lose the stigma, from challenge to change, how people exchange, so we live